Hello students, today we can see another topic, nursing audit. I think all of you are familiar with this term, nursing audit, that is related to the quality assurance. So now we can see what is the definition of nursing audit. Refers to assessment of the quality of clinical nursing, that is the evaluation of nursing care what we have provided to the patient. That is the definition. Then we can see the purpose of nursing audit. The first purpose is evaluating the nursing care given. Second, the verification of what we have done, that's correct or not. Then stimulate to better records. So we are getting a chance. Then focus on care provided and not the care provider. So we are concerned with the care only and we are not concerned with the personal quality. Okay. Then contribute to research. Then communicate standards of care to the subordinates. Then motivate the staff and the job satisfaction to the employees and educational, and then add professional knowledge, identify, analysis and rectify errors and future planning. So these all are the purpose of nursing audit. Then we can see the types. Types are of nursing audit according to the methodology and according to the agency. Okay. According to the methodology, it is retrospective, concurrent and mixed methods are there. What is retrospective? Retrospective means we are looking on the previously what we did, the quality, in-depth assessment of quality after the patient has been discharged and uses the patient's chart as the source of data. So usually we are reviewing the patient's records, that is the retrospective or closed chart. Advantages are we are comparison of actual practices to the standards of care what we have done to the patient. Then it gives total picture of the care. We can review it from the patient's record and it's more accurate data what we are collecting. Then disadvantages, in-depth assessment and then improve only the care of the future client. We can make a change when we are admitting another patients. These all are the retrospective. Then concurrent audit or open chart. Then time to evaluation, that is evaluations conducted on behalf of patients who are still undergoing the care. That's what we have happening at the time itself. Okay. Evaluation of ongoing nursing care rendered by the nurses to the individual patients. So we are gathering the informations time to time what the nurses are giving. Okay. Here we are using the tool, maybe observation checklist, interview or rating scale, etc. Advantages, identification of problem at the time of care, because we are evaluating on the spot. Then identifying and reacting clients' needs during the care. We can analyze that. Then communication on behalf of patients. Then the disadvantages, it's time consuming, because on the time or during the time of care we are observing means it's time consuming and it's very costly and does not give total picture of the care. Then another classification is according to the agency who are carrying out, it's internal versus external. Internal means it's carried continuously by the hospital internal staff. Okay, they are selecting them and they are training them and there are norms and standards for auditing. Then external means outside agency, they are coming, they are conducting the periodical audit. Okay, after the internal audit, there may be some other persons or agencies, they are coming for the external audit. Then what are the concept? There is a mixed type, means both retrospective and concurrent type they can utilize. These all are the three types. Then concept debit type, that is death, complications, LAMA, errors, infection, and credit type. What is the recovery? What is the percentage? And how short the patient stays to the hospital? And then research. What about the research activities? What about the records? These all are the credit points. And the debit, number of death, complications, and LAMA, and errors, and infections. Then types of nursing auditors. Internal auditors are there, that is the nursing experts from within the hospital, and then external auditors, they are from professional associations, that means maybe NABH, JCA or TNA. Then there is an audit committee within the hospital itself, and they are conducting the internal audit. This audit committee maybe we can see it later. The guidelines, they should have some objective or aim to conduct the audit, and then we have to have a control over the audit, and we have to have a set standards that's already from the accrediting agency has given the standards. We can follow that, and what method we are going to use for the audit, and the records also. Then comes the designing. Quality assurance is a priority for us, and those responsible must implement a program. A coordinator should develop and evaluate the quality assurance activities. Then role and responsibility must be delivered, and nurses must be informed about the process and the result of the program, and the data must be reliable. These are some of the guidelines. Then adequate orientation of the data collection, and the quality data should be analyzed and used by nursing personnel to all levels. So we have to have these guidelines with us before starting the audit, and we have to explain to the all members of that organization. Then what are the characteristics of nursing audit? Characteristics, they should have a written standards of care, examination and analysis of findings. It should be written, and it should be to provide high quality care to the patients. Then create a job audit committee should be there. I told you previously that I will tell you later who all are the members of the audit committee. So before carrying out an audit, an auditing committee should be there, and the committee comprises of a minimum of 5 members, and they are who are interested in quality assurance and clinically competent and able to work together in a group. The members are chairman, clinical consultant, representative of the hospital administrator, then they have given here this audit officer, statistician, and nursing personnel, specialized experts. Auditor should have the ability to carry out an audit in about 15 minutes, and if they are less than 50 discharges per month, then all the records may be audited, not more than 10 patients each month, and if there are large number of records to be audited, then an auditor may be selected 10% of the discharge. Then regarding the audit committee, then comes the composition. So representatives of medical administration, medical education, and medical service, then they have given the leaders in education, administrative, and nursing service, and then clinic consultants, then medical record officer, then officer in research cell, then diagnostic department, radiologist, hematologist, etc. Then how to solve the problems? Collect patient data in a systematic manner, state nursing diagnosis and write nursing orders. How to perform it? Then suggest immediate and long term goals, implement the nursing care plan, and plan health teaching for patients, and evaluate the plan of care. Then what do you mean by audit cycle? Audit cycle includes the 5 steps, that is the set the criteria and standards for performance. That is the first one. According to the standards, we can collect maybe INC or maybe JCA or accrediting agencies. Then observe the practices what we are doing in our own organizations, and we have to collect the data, practice what we are doing in our institution. We have to, before setting the criteria, identify the problem, which area we have the problem. So that to be collected, that is the first step. Then second, set criteria and standards. Third, observe the practices and the data collection. Then after collecting all the data, after using any of the retrospective or concurrent method, we are comparing the performance with the criteria and standards what we have it with us, either NABH or JCI or any other accrediting agency standards. Then implementing and making a change, which area we need improvement. Then again we are taking that and we are identifying the problem or issues, and then again setting the criteria and standards. The cycle same is continuing. That's regarding the audit cycle. So during your exam it's important, this audit cycle. Please learn it. Then the models. So here comes the outcome, that is alteration in health status of the customer. What we are doing, the activities are the diagnostic, nursing, medical, rehab, promotive and preventive. The resources are the doctors, nurses, technicians and human and material resources. Outcome mainly based on this age, sex, education and occupation. Then next, nursing audit system. So there are different criteria are there, and study actual practice, compare and then recognize the gap, plan, act, evaluate. Already I told you in the nursing audit cycle. Then comes the approaches. Approaches for all same: structure, process, outcome, approach. What is structure? We know that is the base of that any organization. What facilities we have it, staff, then comes the knowledge, then comes the protocols what we are practicing, and then the equipments. Okay, these all are the structure, process and how we have it with us, the organization. Then the structure, nurses notes, settings, organizational structure, physical facilities, resources and qualification of the employees. Then comes the process. Process includes, we know that how we are giving the care, okay, care to the patients, what are the measures we are using, that it's included in the process. Evaluate whether nurses performed her assigned duties. Then the outcome standards are the important thing, the discharge of the patients, stay of the hospital, and then the condition of the patients, it's according to the standard, and morbidity and mortality rate is reduced. Okay, these all things are the outcome standards. Nursing assessment of every patient is carried out within half an hour of admission. Every patient is given orientation to the unit facilities immediately on admission. Then nursing assessment of every patient is that same thing. Then effective hand washing, then effective endotracheal suctioning on the basis of the practice or not. Then the advantages of this nursing audit, we can see it's very effective and we are utilizing in all systems, and it's a reflection of the quality of care. Method of measurement in all areas of nursing we can utilize it. Scoring system is fairly simple and the results easily understood, and the development of local guidelines and protocols. Then assess the work of all those involved in recording. So it's a evaluation of the documents. Useful tool as a part of quality assurance program. Then reduce incidents, complaints and minimize the errors and harm to the patient if you have audit. There is improvement in the practice, develop openness to change and provide assurance and listening to patients, understanding their expectations. I think it's clear. Then the disadvantages of nursing audit. Where there is nursing process has not been implemented, it's not useful, and many of the components overlap, making analysis is very difficult for them. Okay. Then it's time consuming, requires a team of trained auditors we required. Already I told you, internal auditors. Then deals with a large amount of information and only they can evaluate the record keeping, and it only serves to improve the documentation, not the nursing care. So now you have discussed all the aspect of the nursing audit. What is left is role of nurse manager in nursing audit. So you know that we have to prepare an audit committee with the approval of the authority and consult audit committee with the select members, conduct a regular meeting with the members, and then audit make sure that they are identifying the right problem and issues. Then follow all steps of the audit process, and then ready with the action plan and use the guidelines what they have given by the organization. So I think the topic is clear to you. If you have any doubt, you can ask. All the aspects I have covered, and you can see the previous videos also, and then you can utilize it for your exam. It's a common question during your university exam, short note or a part of essay also. Okay, thank you students.